All right, let's get right into it. When you think about fighting cancer, you're probably thinking about treatments, cells, the immune system, right? But what if I told you one of the most critical battles is being fought over something we all have in our bodies? Iron. Today, we're going to unpack cancer's hidden struggle, the iron paradox.
So here's the big question, and it seems simple, but it's anything but. For someone going through cancer treatment, is iron a friend that helps them stay strong, or is it actually a foe, feeding the very disease they're trying to beat? Well, as you're about to see, it's weirdly both.
And this slide right here lays out the whole problem perfectly. On one side, you've got anemia. This is when there's too little available iron for your body to use, and it's a huge problem linked to poor outcomes. But on the other side, the body starts hoarding iron, creating too much stored iron, which we measure as ferritin. This causes inflammation and, you guessed it, is also linked to poor outcomes. So you're stuck. Too little is bad, and too much is also bad. That's the paradox. So think of it this way. Cancer is like a really smart thief. It steals the iron your body needs to function, which causes that anemia and makes you feel weak. But it doesn't just use the iron. Oh no. It locks it away in these little molecular vaults called ferritin to create its own private stash, using it as fuel to grow and spread. Okay, so why are we so focused on this? Because this whole iron balancing act, it's not some minor side issue. It is directly connected to how well treatments actually work. And honestly, the numbers here are staggering. Just look at the impact of getting this right. In studies on lung and breast cancer, patients who had healthy hemoglobin levels, which is a sign they have enough working iron, had more than double the response rate to immunotherapy. I mean, double. That is a massive, massive difference. But here's the flip side of that coin. When that stored inflammatory iron, that ferritin vault we talked about, gets too high, the consequences can be just as huge. In some cases, high ferritin is linked to a shocking drop in median survival, sometimes by as much as 60%. So the main takeaway here is that iron balance is a huge predictor of success. And listen, with up to 90% of patients dealing with anemia during their treatment, this is not a niche problem. Both low hemoglobin and high ferritin are consistently flagged in research as powerful, independent signs that can predict a tougher road ahead. So you're probably thinking, how on earth do you solve a problem like this? If just dumping more iron into the system is risky, what's the move? Well, this is where the science gets really interesting and introduces us to a protein called lactoferrin, which seems to act like a smart regulator. So what exactly is it? Lactoferrin is a totally natural protein, and like the name suggests, you find it in milk. Its superpower is that it's fantastic at binding to iron, and by doing that, it helps control how much iron your body absorbs, it supports your immune system, and, this is the crucial part, it helps rebalance those out-of-whack iron levels we've been talking about. And this slide, this is the real aha moment. It's a tale of two strategies. Traditional iron supplements, yeah, they can help boost your hemoglobin, which is a check in the good column. But the huge risk is that they can also fuel that dangerous stockpile of inflammatory ferritin. Lactoferrin, on the other hand, appears to have this amazing dual action. It helps boost hemoglobin while also helping to bring that inflammatory ferritin down. It's not just adding fuel, it's helping manage the whole system. And let's put some real numbers to that from a study on advanced cancers. Patients on regular iron supplements saw their inflammatory ferritin levels shoot up by 60%. But the group taking lactoferrin, their levels actually went down by 16%. That's not just a small difference, that is a complete reversal of the trend. Okay, the theory sounds great, right? A smart regulator sounds exactly like what's needed. But does it actually make a difference for real patients in the real world? Let's follow the clinical evidence and see what the trials say. And the signals coming out are really encouraging. For instance, a pilot study looking at patients with metastatic kidney cancer found that some of them experienced greatly extended disease-free periods. I mean, that's a powerful phrase, and it suggests a real tangible impact. Then you've got a phase 2 trial in lung cancer that puts some hard numbers on it. Just look at this chart. The median time before the cancer progressed for the group on a placebo was 4.2 months. But for the group getting lactoferrin, it jumped to 7.0 months. That's a nearly 3-month difference, which is a huge deal. And it doesn't stop there. Across different trials, researchers have seen other positive signals. Things like a 20% drop in serious chemo side effects, a significant slowdown in tumor growth, and in some truly remarkable cases with kidney cancer, patients staying progression-free for more than 30 months.
So let's pull all of this together. What is the big takeaway here? What does all this research mean for someone who's actually on a cancer journey, or for their loved ones? Really, it's about understanding there's a path to finding balance.
So here are your actionable takeaways. First, just recognize that this iron paradox is a real thing in cancer. Second, understand the high stakes involved, that this balance really can impact your treatment. Third, you can explore the evidence for these smart regulators we've been talking about. And number 4, and this is the most important one, use this knowledge to start an informed conversation with your doctor.
Which brings us to this final thought. In the incredibly complex puzzle of cancer care, where we put so much focus on the treatments themselves, could focusing on something as fundamental as iron balance be one of the critical, missing pieces of the puzzle for supportive care?
And of course, we have to say all of this is for educational purposes. It is not medical advice. The whole point of this explainer is to arm you with information from the latest research so you can have a really productive, informed conversation with your oncologist about what's best for you. Thanks so much for joining us.